my name's Ashley, and I'm going to be talking to you today about behavioral and psychological symptoms of dementia. So, in this presentation, I'll talk to you about some different common behavioral and psychological symptoms of dementia, just what some common ones are. I'll talk about some of the different causes and triggers that might lead to those behaviors, and then I'll go through some different strategies that you might want to use to help prevent those behaviors. And after all that, your facilitator today is going to go through a discussion with you and work through some case studies to help you apply what you've learned from this presentation. So, what are behavioral and psychological symptoms of dementia? These are symptoms of disturbance in perception, thoughts, mood, and behavior that occur when a person's living with dementia. And there's a variety of different symptoms that can occur. And so these are just some common ones listed here. And this list is not meant to frighten you at all. It's just to kind of show you that these are things that can occur. So not all of these are going to occur in someone with dementia because there's many different kinds of dementia and every person is different. So these aren't all going to occur in one person with dementia, but these are just things that are more common that might happen. So it's really more just to prepare you. So some common ones are anxiety and depression, and that is fairly common in people living with dementia and various forms of dementia. Disturbances with sleep, so this could also be something that is called sundowner syndrome, where someone might get very anxious or agitated in the evening. They'll have trouble sleeping then. Wandering or getting lost can happen. Refusal of care with activities of daily living. This could be things like not wanting to take medications or not wanting to take a shower or brush their teeth, things like that. And then also aggression could happen, and that could be verbal or physical. So those are just different common ones that might happen. So why do these occur? So we don't really know exactly why these behaviors occur neurologically speaking, but we know that there's physical, social, cognitive, mental, and environmental factors that affect those behaviors. And so I think down below, this is a nice visual to kind of show what's happening. So really when there's these triggers that will cause this person to get overwhelmed and then they have these behaviors. And there's an author, a woman who's living with dementia herself. She got diagnosed with early onset Alzheimer's disease, and her name is Christine Bryden. She's written some books about her experiences, and I really liked the way that she called this. She called it adaptive behaviors, and I think that's a really nice way to frame it, is that these are really behaviors happening because the person is having trouble communicating a need and they're doing their best to just adapt. And so if you think about that, as we all get older, as we all grow, we all learn different ways to cope, different strategies to cope with things. And when someone develops dementia, they tend to lose those coping strategies. So they can't cope the same way that they used to. So this is just the best that they have, the best they can do with the tools in their toolbox. And so I think adaptive behaviors is a really good way to think about it. And also, the context of who that person is going to play a big part in what kind of behaviors they have. So something like their past social roles, their preferences, their personality, if they've had any trauma, that can all play a part in what kind of behaviors we see. So as an example, there was an article I had read about this woman who was a nurse, and she eventually developed dementia, and then she had to go into a nursing home, into a facility. And she kept getting really upset in the evening, and she would get really agitated and she wanted to leave. And it took the staff a while to realize that this was always happening at shift change, which is what in nursing, at shift change, it's time to go home. And so for her, that made a lot of sense that it's time to go home because it's shift change, everyone else is going home, so it's time for her to go home. So things like that can make a big difference in what kind of behavior someone is presenting. So those are just kind of things to think about why they might be happening. So some other things to think about with these behaviors is that these are a symptom of dementia. So they're not a choice by the person living with dementia. This is not intentional. It's not done on purpose. It's really just like I was saying before. These are just their best way that they know how to adapt. And they're not revealing some hidden part of themselves. This isn't just some secret part of themselves that they had not shown before. It's really just the best that they can do, and they're trying to adapt, and They don't have any other way at that moment to communicate this need that they're having. Also, just to remember that there's always a reason behind the behavior. So it's really important to try and think about what could have caused or led or triggered to that behavior, and think about what we could do to help prevent that from happening in the future. And then also just remembering that there's always going to be good days and bad days, and everyone's allowed to have a bad day. Someone might have a bad day and they're anxious and they're frustrated. That doesn't necessarily mean they're having a behavioral symptom. They might just be having a bad day. So just to kind of relax the rules a little bit, and just remember that it's okay for someone to have a bad day every now and then. Okay, so now we're going to talk about some different ways to help manage and prevent those behaviors. So this is a nice visual to kind of show sort of the process that we're going to be thinking about. So ideally, we want to start with prevention. So there's a lot of different things that can lead to behavioral symptoms of dementia. So things like loud noises, competing noises. So if there's a big crowd around, I know a lot of people that I've talked to that are living with dementia, they don't do very well in crowds anymore. It's too much stimulus. It's too hard for them to concentrate. So they don't do well in crowds or with loud noises. So also things, like I said, competing noises. So if there's a TV on or a radio on in the background that's competing while you're trying to have a conversation with them, that's pretty difficult. Also, too many bright lights or glaring lights can be a trigger. And then things like poor sleep, or maybe change in routine. Routine's very important for people living with dementia. That's very helpful for them to have a routine, so when it gets changed, that can lead to some behaviors. Also, medication side effects, which we'll talk a little bit about more later. So again, ideally we want to try and prevent these triggers as much as we can, but the reality is that sometimes they're going to happen. Things happen. We can't control everything. And so then we want to see, well, what kind of intervention can we do to help get to a resolution with these behaviors? So this is a model that you can use to help manage behaviors, and I think it's pretty helpful. This came from a book called Dementia Beyond Drugs that was written by Dr. Power. He's a geriatrician. He's done a lot of work with people living with dementia and cared for people living with dementia for many years and has a lot of experience. And he wrote this book to kind of talk about explaining some things about dementia, but also different ways to help manage behaviors and other things. And this is one model that he brought up that some experts have put together that I think could be very helpful for people. So basically, it's taking on these 4 roles when thinking about managing behaviors. And so the first one is to be a magician. And so that just means to put yourself in their shoes. And that's a little bit easier said than done, but trying to really put yourself in their shoes and think about what they're going through. Think about where they're at, what their reality is at the moment, and just really try and put yourself in that mindset. And then trying to be a detective, so trying to find that cause and trigger of the behavior, and that's also pretty tricky, but just trying to think about what's going on around them in the environment, what happened before the behavior started, trying to really just dig and think about what could have led to that behavior. And then we want to try and be a carpenter and try and work towards building a solution. So trying to think about what we could do if that behavior happens. Okay, what can we do to help resolve it, and kind of prevent that behavior as much as we can, but just resolving it if it's already happened too. And then the last one is to be a jester, which is really just about trying to still remember to find the joys in caregiving. And caring for someone with dementia is a very challenging job, and it's very hard, but still trying to remember just to keep the joy as much as you can and keep your sense of humor still. So when thinking about different triggers or causes that could lead to some of these behaviors, a good place to start is with the physical needs. So thinking about, are these physical needs being met? So one to start with is if we think that person might be in pain. Sometimes when someone has mid or later stages of dementia, they may not be able to say that they're in pain or tell you. So trying to look for visual cues. So if they're grimacing or if they're shifting around a lot in their seat, if they look just kind of uncomfortable, they might be in pain. Also, hunger or thirst. So, again, they may not be able to tell you if they're hungry or thirsty, or even if they need to go to the bathroom. So, trying to think, how long has it been since they ate? How long has it been since they had some water? I actually talked to one person who said that their loved one was not drinking water very much. So, they actually left lots of cups of water around the house. So, every time that person wanted some water, they could just get some as they were walking around the house. So, they may not be able to tell you they're thirsty or hungry, so just trying to keep in mind when was the last time they ate or drank something, and then going to the bathroom. If they look like they're shifting around again, maybe they have to go to the bathroom and think about, how long has it been since they went. Also, hearing aids and glasses. So, without hearing aids and glasses, it can be really hard for someone to know what's going on around them, and that can obviously lead to more confusion, and that can lead to behaviors. So, trying to make sure that they have their hearing aids, their glasses, those adaptive devices to help them feel more grounded in what's going on. They can see what's going on around them, and that can certainly just help with confusion too if they can actually hear and see everything. And then also thinking about if there's too much stimulation. So, like I was saying before, loud noises can be difficult for someone living with dementia, or crowded places, competing noises. They can lead to too much stimulation and make it hard for someone with dementia to concentrate and focus, and then they can have some behaviors. So, sometimes just thinking about that is there too much stimulation going on? Also, new medication. So, someone with dementia, they have changes in their brain, so they may not respond the same way to medication that they did if they didn't have dementia. So, thinking about that, if they start a new medication and then they have these behaviors, maybe it's a side effect from the medication. And so, just going to talk to the provider about that as well. So, when thinking about medications, I also just wanted to mention that medications should really not be the first choice when thinking about managing behavior. Sometimes it's kind of easy to go to that first, but we really want to try and focus on these other strategies first before we go to medications. Sometimes it's still going to be necessary. So, if someone has not slept for 3 days, they need medication to help them sleep. So, sometimes we can't get around that, and we need to give them a medication to help them. But as much as we can, we want to try and do these other strategies and problem solve to help manage these behaviors before we go to that. And then, of course, if you do need to use a medication, just make sure you're always following the guidance from your healthcare provider and communicating with them about this, and just really follow their guidance. So now I want to think about the emotional needs. Are those emotional needs being met for the person? So things like being treated with dignity. A lot of times when someone is diagnosed with dementia, they tend to not be included in conversations as much anymore. Sometimes they're not even talked to like an adult. They might be getting talked to like a child sometimes. So trying to think about, are they really being treated with dignity and respect, because that does a lot for someone's self-worth. It can help make them feel valued and respected. And so it makes a big difference for someone, and it can certainly lead to some anxieties and depression if they're not being treated with dignity and respect, and lead to some of those behaviors. Also, is their independence being supported? So, again, when someone gets diagnosed with dementia, a lot of times their choices are being taken away from them. They have the car keys taken away. They don't get to make as many decisions in their health care or those big decisions in their day to day life. So, trying to give little choices as much as we can, trying to do whatever we can to help support their independence and give them that autonomy. And that can be even little choices, something like, do you want orange juice or coffee with breakfast today? Those little choices can add up and make a big difference for someone, and how much autonomy they feel like they have in their independence. So trying to think about those things too. Also, our body language. So as someone progresses with dementia, they may start to lose some of their verbal communication abilities, and they are going to have to rely more on their nonverbal communication. And so they can still read your body language very well, and it makes a big difference. So thinking about how we're presenting ourselves when we're talking to someone living with dementia. And when they're upset, if they're having a behavior, or if they're just upset and then you're upset, it's really hard to think about your body language at that moment. But trying to really take a step back and think about, okay, how am I presenting myself to them right now? And maybe just taking a step back if you are upset or if they're upset, and just give it a little break for a minute, because that body language makes such a big difference. And people living with dementia may not always remember what you say, but a lot of times they'll remember how you made them feel. And so thinking about that body language can just make a big difference too. And here's another framework to think about. This one's the ABC framework. And so with this one first, we want to start with the behavior, which is the B, and think about what's the behavior that we're seeing. And then we want to think about what's the antecedent. So what happened before that behavior? What could have caused the behavior? What could have triggered it? And then we want to think about, see, the consequences. Whether is that behavior resolved? What did we do to resolve it? And kind of work through it that way. And now your facilitator for today is going to go through some case studies with you. But thank you so much for listening to this, and I hope you have a good day. Thank you.